If your doctor has been unable to resolve your or your loved one's condition, please leave us a comment with a brief description. We will get back to you with current research information. Food poisoning. Each year, around 48 million people in the United States get sick from contaminated food. Common causes include bacteria and viruses. Less often, the cause may be a parasite or a harmful chemical, such as a high amount of pesticides. Symptoms of foodborne illness depend on the cause. They can be mild or serious. Symptoms usually include upset stomach, abdominal cramps, nausea and vomiting, diarrhea, fever, and dehydration. Most foodborne illnesses are acute. This means that they happen suddenly and last a short time. Contamination. It takes several steps to get food from the farm or fishery to your dining table. Contamination can happen during any of these steps. For example, contamination can happen to raw meat during slaughter, fruits and vegetables when they are growing or when they are processed, and refrigerated foods when they are left on a loading dock in warm weather. But it can also happen in your kitchen if you leave food out for more than 2 hours at room temperature. Handling food safely can help prevent foodborne illnesses. Most people with foodborne illness get better on their own. It is important to replace lost fluids and electrolytes to prevent dehydration. If your healthcare provider can diagnose the specific cause, you may get medicines such as antibiotics to treat it. For more serious illness, you may need treatment at a hospital. Food poisoning. Each year, around 48 million people in the United States get sick from contaminated food. Common causes include bacteria and viruses. Less often, the cause may be a parasite or a harmful chemical, such as a high amount of pesticides. Symptoms of foodborne illness depend on the cause. They can be mild or serious. Symptoms usually include upset stomach, abdominal cramps, nausea and vomiting, diarrhea, fever, and dehydration. Most foodborne illnesses are acute. This means that they happen suddenly and last a short time. Contamination. It takes several steps to get food from the farm or fishery to your dining table. Contamination can happen during any of these steps. For example, contamination can happen to raw meat during slaughter, fruits and vegetables when they are growing or when they are processed, and refrigerated foods when they are left on a loading dock in warm weather. But it can also happen in your kitchen if you leave food out for more than 2 hours at room temperature. Handling food safely can help prevent foodborne illnesses. Most people with foodborne illness get better on their own. It is important to replace lost fluids and electrolytes to prevent dehydration. If your healthcare provider can diagnose the specific cause, you may get medicines such as antibiotics to treat it. For more serious illness, you may need treatment at a hospital. When to see a doctor. If you experience any of the following signs or symptoms, seek medical attention. Frequent episodes of vomiting and inability to keep liquids down. Bloody vomit or stools. Diarrhea for more than 3 days. Extreme pain or severe abdominal cramping. An oral temperature higher than 100.4 degrees Fahrenheit. Signs or symptoms of dehydration including excessive thirst, dry mouth, little or no urination, severe weakness, dizziness, or lightheadedness. And neurological symptoms such as blurry vision, muscle weakness, and tingling in the arms. Causes. Whether you become ill after eating contaminated food depends on the organism, the amount of exposure, your age, and your health. High-risk groups include older adults. As you get older, your immune system may not respond as quickly and as effectively to infectious organisms as when you were younger. Pregnant women. During pregnancy, changes in metabolism and circulation may increase the risk of food poisoning. Your reaction may be more severe during pregnancy. Rarely, your baby may get sick too. Infants and young children. Their immune systems haven't fully developed. and people with chronic disease. Having a chronic condition such as diabetes, liver disease or AIDS, or receiving chemotherapy or radiation therapy for cancer reduces your immune response. Complications. The most common serious complication of food poisoning is dehydration, a severe loss of water and essential salts and minerals. If you're a healthy adult and drink enough to replace fluids you lose from vomiting and diarrhea, dehydration shouldn't be a problem. Infants, older adults, and people with suppressed immune systems or chronic illnesses may become severely dehydrated when they lose more fluids than they can replace. In that case, they may need to be hospitalized and receive intravenous fluids. In extreme cases, dehydration can be fatal. Some types of food poisoning have potentially serious complications for certain people. These include Listeria infection. Complications of a Listeria food poisoning may be most severe for an unborn baby. Early in pregnancy, a Listeria infection may lead to miscarriage. Later in pregnancy, a Listeria infection may lead to stillbirth, premature birth, or a potentially fatal infection in the baby after birth, even if the mother was only mildly ill. Infants who survive a Listeria infection may experience long-term neurological damage and delayed development. And Escherichia coli, E. coli. Certain E. coli strains can cause a serious complication called hemolytic uremic syndrome. This syndrome damages the lining of the tiny blood vessels in the kidneys, sometimes leading to kidney failure. Older adults, children younger than 5, and people with weakened immune systems have a higher risk of developing this complication. If you're in one of these risk categories, see your doctor at the first sign of profuse or bloody diarrhea. Prevention. To prevent food poisoning at home. Wash your hands, utensils, and food surfaces often. Wash your hands well with warm soapy water before and after handling or preparing food. Use hot soapy water to wash utensils, cutting boards, and other surfaces you use. Keep raw foods separate from ready-to-eat foods. When shopping, preparing food, or storing food, keep raw meat, poultry, fish, and shellfish away from other foods. This prevents cross-contamination. Cook foods to a safe temperature. The best way to tell if foods are cooked to a safe temperature is to use a food thermometer. You can kill harmful organisms in most foods by cooking them to the right temperature. Cook ground beef to 160 degrees Fahrenheit. Cook steaks, roasts, and chops such as lamb, pork, and veal to at least 145 degrees Fahrenheit. Cook chicken and turkey to 165 degrees Fahrenheit. Make sure fish and shellfish are cooked thoroughly. Refrigerate or freeze perishable foods promptly within 2 hours of purchasing or preparing them. If the room temperature is above 90 degrees Fahrenheit, refrigerate perishable foods within 1 hour. And defrost foods safely. Don't thaw food at room temperature. The safest way to thaw food is to defrost it in the refrigerator. If you microwave frozen food using the defrost or 50% power setting, be sure to cook it immediately. Throw it out when in doubt. If you aren't sure if a food has been prepared, served, or stored safely, discard it. Food left at room temperature too long may contain bacteria or toxins that can't be destroyed by cooking. Don't taste food that you're unsure about, just throw it out. Even if it looks and smells fine, it may not be safe to eat. Food poisoning is especially serious and potentially life-threatening for young children, pregnant women and their fetuses, older adults, and people with weakened immune systems. These individuals should take extra precautions by avoiding the following foods. Raw or rare meat and poultry. Raw or undercooked fish or shellfish, including oysters, clams, mussels, and scallops. Raw or undercooked eggs or foods that may contain them, such as cookie dough and homemade ice cream. Raw sprouts, such as alfalfa, bean, clover, and radish sprouts. Unpasteurized juices and ciders. Unpasteurized milk and milk products. Soft cheeses, such as feta, brie, and camembert, blue vein cheese, and unpasteurized cheese. Refrigerated pâté and meat spreads. And uncooked hot dogs, luncheon meats, and deli meats. We hope you have found this information valuable. If you enjoy these videos and want to support us being able to continue creating content for many years to come, we'd love for you to consider becoming a patron of Converged Medical Research. The link for becoming a patron is in the description below. We have many other sessions on medical-related topics coming. If you need information on a particular topic, please leave a comment below. Please click the subscribe button and ring the bell.